Okay, I'm going to talk about the ankle block landmark technique. So the foot is innervated by 5 nerves. Two a deep nerve. One is the deep peroneal nerve and posterior tibial nerve, and 3 superficial nerves. A saphenous nerve and superficial peroneal nerve, and then sural nerve. Okay, so the deep nerves, deep to the extensor and extensor reticulum. This is the medial malleus, and this is the lateral malleus, and this is the landmark. And we ask the patient to dorsiflex the foot, so you can feel the tendon. So this is extensor oleus longus tendon, and this is the extensor digitorum tendon. Okay, you can have patient relax. So when you do the deep peroneal nerve, your needle perpendicular, just lateral to the extensor hallucis tendon, perpendicular to the tibial bone. Once you touch the bone, withdraw a couple millimeter, inject 5 cc of the local anesthetic, and then withdraw the needle partially, and redirect needle to the medial side towards the medial malleus. Okay, and inject about 3 to 5 cc of the local anesthetic while withdrawing the needle. So this will anesthetize the saphenous nerve, and then redirect needle to the lateral sides, to the lateral medius, and then withdraw the needle and you just start injecting local anesthetic. This will anesthetize the superficial peroneal nerve. Okay. Now we're going to do the tibial nerve. This is very important nerve in the ankle block. So the tibial nerve located posterior to the medial malleus. So you feel the pulse. This is posterior tibial artery. You feel the pulse. So needle entrance just posterior to the pulse. And once you touch the bone, withdraw 1 millimeter and inject 5 cc's. But this nerve is very important. Sometimes if you don't feel the pulse, you can use Doppler to locate the artery, or you can use ultrasound. If you don't have, ultrasound or Doppler, you can't feel the pulse, you can inject just this is our Achilles tendon, this is the medial malleus, just the midline. Just inject your needle there, and then start injection like a fan type of injection. Will numb that posterior tibial nerve. Now we're gonna anesthetize the sural nerve. The sural nerve is just posterior to the posterior medius. Traditional teaching method is, this is Achilles tendon, the entrance go lateral to the Achilles tendon toward the lateral medius, start injecting the local anesthetic. But this approach, there's some difficulties. Since patient is supine, you either have to elevate the leg injection, or put the patient's legs on the side of the gurney, do the injection, or have patient turn to the side, then you can anesthetize this nerve. But what I do is I keep patient supine. I just go from here to the lateral side of lateral malleus, I only turn the foot inward, so bring the tissue up. So there's no gap, no dip. So I entrance here, my needle aiming to the lateral side of Achilles tendon, a star injection while withdrawing my needle will be easier to anesthetize the soror nerve. Have patient dorsal flex the foot and then mark the tendons. Feel the posterior tibial artery pulse. And the mark side of needle entrance. This is a chloral prep to clean the ankle. Make a skin well to numb the skin, and the perpendicular lateral to the tendon. Once touch the bone, withdraw a couple of millimeters and start injection. Local anesthetics, about 5 cc's. And withdraw the needle partially, and redirect needle to the medial side, towards the medial malleus. You can use your finger to help the needle bend, and withdraw the needle. Redirect to the lateral medius, and aspirate, inject to anesthetize the superficial peroneal nerve. And inject a little bit more. Now I'm doing the tibial nerve block. So feel the pulse, just inject needle posterior to the pulse. Inject 5 cc of local anesthetic. So I'm going to do the soror nerve block. Okay, and this is the chloral prep. I'm going to clean the area. So I rotate patient's foot inward a little bit, and this is the edge of the lateral medius. So my needle bevels up. I inject from the side of the lateral medius. My needle aiming to the lateral Achilles tendon. Okay, then aspirate the blood. Okay. Aspirate again. Blood. Okay. So I redirect my needle, make sure there's no blood return. Okay, now it's negative. Start injecting while I'm withdrawing my needle. Okay, done.